What are the vital signs? Signs are clinical parameters that reflect the physiological state of the human organism and essentially provide the data that will give us the guidance to evaluate the homeostatic state of the patient, indicating her present state of health as well as the change or its evolution, either positively or negatively. Vital signs include temperature, respiratory rate, heart rate, blood pressure, and oxygen saturation.
Body temperature represents a balance between the heat produced by the body and its loss. Always clean the thermometer before and after use. The temperature can be taken in the mouth, rectum, or armpit. Check that the thermometer is set to 0. Place the thermometer in the armpit. Press the arm against the body. Wait 1 to 2 minutes before taking the reading.
The heart rate. The heart rate is the number of times the heart contracts during 1 minute. As a general rule, the normal resting rate ranges from 60 to 100 beats per minute. Can be measured at the neck, carotid pulse, and wrist and radial pulse, and groin and femoral pulse, inner lobe and ulnar pulse, back of the knee and popliteal pulse, temporal pulse, or inner foot and medial pulse. You can take your pulse at the radial artery or the carotid artery in the neck. Some health conditions may be a determining factors in which is the best place to take your pulse. The material necessary is what second hand, index and middle finger, and pen and recording sheet. How to take your pulse. Place the tips of the index and middle fingers on the inside of the wrist below the base of the thumb. Press lightly. You will feel the bleed pulsing under the fingers. Use a wall clock or wristwatch on the other hand and count the heartbeat you feel for 1 minute or for 30 seconds and multiple by.
Respiration. Respiration is the process constituted by the transport of oxygen to the body tissues and the expulsion of carbon dioxide. The process consists of an inspiration and expiration diffusion of oxygen from the pulmonary alveoli to the blood and carbon dioxide from the blood to the alveoli, and transport of oxygen to body tissues and organs. These are the actions carried out to know the frequency, rhythm, and amplitude of a patient's breaths. The objective is to know the variation in the patient's respiration, to assess their state and course of the disease. Material and equipment. Watch with a second hand, pen and notebook, report sheet, and chart for vital signs. The process is: first, transfer the equipment to the patient unit. 2. Verify patient identification data called you by name. 3. Hand washing. 4. Explain the procedure to the patient. 5. Observe the elevation and descent of the patient's abdomen for 30 seconds. Multiply by 2 and observe depth and effort to breathe, amplitude and rhythm of the breaths. Zone in case of presence. Coloring of the patient. A full minute is more appropriate for abnormal breathing patterns. 6. Record the respiratory rate obtained in the corresponding sheet of the clinical file and graph it. Observe if the rhythm and depth are altered. Write down the date and time of the procedure. 7. Compare the respiratory rate with previous records. Good morning. Hello, my name is Romina and I will take your respiratory rate. How many times you inhale and exhale? Thank you.
Taking blood pressures. They are the actions that are carried out to determine the force exerted by the blood and the walls of the arteries. Depends on the force and the cardiac contraction. The goals. Obtain the variant, register them, and to evaluate the cause of the patient issues. Operations to evaluation of the figures. It's systolic, diastolic, and differential. The systolic when the heart departs blood into the arteria, and diastolic is the period of the reelection. And differential is difference between the systolic and diastolic pressures. The necessary material and equipment is a biometer, binaural stethoscope, bracelet appropriate to the complex of the patients, the notebook and the pen for the notes, and reporter sheets and the chart for the vital signs. The process. The first, move the equipment with the patients. Verify the identification for the patients to the patient. Uncover the patient arm. Place the cuff around the arm 2.5 centimeters above the elbow. Verify that the cuff is completely disinflated. The pressure gauge the shall read 0. Locate the radial pulse with the tips of the index in the middle finger. Put on the stethoscope and the compressions in the artery. Close the sulfur node. Inflate the cuff until the pressure gauge reaches 200. Gradually disinflate the cuff, listening to the first breath that correspond to the systolic pressures, and continue to the crest cuff pressures until the last breath. Disinflate of the cuff completely, and finally record the frequency of the blood pressures obtained.
Option saturation values. When taking blood from artery cerebral, parameters can be measured. Such option saturation correspond to the level of option present in the red blood cell. Between 94 and 98, option saturation is good. Between 90 and 93, it is said to be mediocre. Below 19, we are talking about desaturation. When a person is poorly oxygenated, one speaks hypoxemia. Option saturation is a parameter that refers to the percentage of hemoglobin that is bound to oxygen. The blood is a compost of the red blood cells, where hemoglobin is present, which is responsible for the carrying the object necessary for the self of your body function. The heart plays a central role in this action as a pump. On the right side, it receives and expels oxygen blood to the lung. The left side of the heart receives oxygen-rich blood from the lung and sent into body arterial system. What is an oximeter? An oximeter is a lightweight device that lets you keep track of the quantity of oxygen saturation in your body. How to use an oximeter? The little clip-like device can be set in your finger. This is where you feel a percentage of the pressure. However, you will not feel any discomfort or pinching.